I have reviewed my doctor's orders, and I have an order to place a urinary indwelling catheter. So I'm going to go in the patient's room. I'm going to follow standard protocol. I'm going to wash my hands, of course, introduce myself to the client, and identify the client. And then I'm going to ask if the patient has any allergies to iodine or latex, and if so, I'll get different materials. And in this case, they don't, so I'm going to continue on. All right, I'm going to provide privacy and assist the patient into dorsal recumbent position. I'm going to provide perineal care with clean gloves, of course. And then I'm going to set up my sterile fill. Okay. I'm going to put on my sterile gloves. I'm going to glove my dominant hand first. Okay, I'm going to place my pad down, shiny side down, without contaminating. Okay, I'm not going to use the fenestrator drape. Rather, I'm just going to lay it down, kind of give me extra sterile fill. Alright. Now, I'm going to open my iodine swabs, slosh it around, get all the iodine on it, and place it on my tray, and then discard. I'm going to do the same with the lube. I'm going to pour it out and discard. I'm then going to test my balloon for my catheter. Alright, the balloon is inflated and there's no signs of leakage or any defects. So I'm going to deflate the balloon. I'm going to leave my syringe in place. Alright. I'm going to unwrap my catheter. Give you control over it. And I'm going to lube 2 inches of it. Really good. And then return it to the box. Alright. And then going to use my non-dominant hand and spread the labia. I'm going to get my iodine swab, tell the patient that this may feel a little cold. I'm going to wipe outer from front to back and then discard. And wipe inner from front to back, then discard. I'm going to wipe the middle from front to back, right down the meatus, then discard. Alright. I'm going to instruct the client that I'm now going to advance the catheter in. She may feel a little discomfort. Okay. I'm going to ask her to take a deep breath for me. I'm going to advance it, making sure I feel no resistance. If I feel any resistance, I'm going to stop, have the client take a deep breath, and rotate the catheter slowly, but not forcing it. But anyway, if I don't feel resistance, I continue to advance until I see urine. And when I see urine, I'm going to advance it 1.5 to 2 more inches, and then I'm going to inflate my balloon. Okay, after the balloon is inflated, I'm going to tug just a little, just to make sure I feel resistance there. It's in the bladder. So I'm going to remove my syringe. And now I'm going to tape the catheter to the inner thigh in the female or the lower abdomen in the male. Okay. I'm going to hang my drainage bag on the bed frame. I'm going to have my catheter or my drainage tube going straight down from the bed. No dependent loops, and all the loops will be coiled on the bed. Then I'm going to pin my tube to the bed sheets. Okay, once that is done, I'm going to provide perineal care, and then I'm going to put all this in biohazard. Okay, I'm going to also make sure there's enough slack here, if I had good tape. I'm going to make sure there's enough slack to where the patient can move freely and not tug and pull at the catheter. I'm going to assist my patient back into a comfortable position. Ask her if she needs anything. Remove my gloves. Cover her back up. Place the call light in reach. Lower the bed. Okay. Now I will document. I'm going to document the time and date of the procedure, the reason for the procedure, which is per orders. I'm going to document perineal care before and after the procedure. I'm going to document the type and size of the catheter used, if the balloon was present, and what type and how much fluid was inserted into the balloon. I'm going to document color, amount, and consistency of the urine, patency of the tube or the catheter, and placement where I taped it on her inner thigh or lower abdomen. I'm going to document the placement of the drainage bag, which is on the bed frame, and I guess how the patient tolerated the procedure. And that's it.